Look around you at your colleagues, your relatives, your spouses, your neighbors. Very few of them might be bouncing around with energy right now. Well, it is that time of year when our bodies and minds start to slow down and burn out. Add to that this has been no ordinary year. 2020, the pandemic year, has left us even more stressed and fatigued than usual. Many of us unable to feel even an ounce of that festive cheer at the moment. Well, how do we recognize year-end fatigue and how can we beat it? How do we know whether it is run-of-the-mill year-end fatigue or a more serious case of burnout? Well, on Health Focus today, we're asking the experts to help us identify the signs and give us some tips on how to cope. Well, let's get cracking right now with endocrinologist Dr. Daksha Jivan. Dr. Jivan, a very good morning to you. Thanks so much for your time this morning. So let's start firstly with a definition of year-end fatigue. What is it?
That's a difficult one. I don't even know what year-end is, what year-end fatigue is. I don't know what beginning of year fatigue is. I think that's important for people to realize is that it's something out of the ordinary. So they need to recognize that this is something different for themselves.
So let's look at the signs and symptoms. We know, yes, you know, it kind of makes sense that you're coming to the end of a busy work year. If you're lucky enough to have leave at this time, you might be looking forward to that. What is happening in our minds, in our bodies? What are the signs that we've actually reached the end of our tether here?
So first one I want to talk about is, does the fatigue relieve itself? Is it chronic? Is it ongoing? Some people say they might not be getting enough sleep, all right? And I want to say, if you've had a good night's sleep, if you've had a few nights of sleep, that fatigue should settle. So the time that you know that it's unusual and abnormal is if the fatigue is ongoing, persistent, chronic.
All right, so I mean, you know, this could be signs of a whole host of other problems as well. I mean, you know, we know that things are happening hormonally at a certain stage in our lives as well. So as an endocrinologist, what would you recommend to somebody who comes to you with some of those symptoms around this time of the year? What would you do for them?
It's a common complaint. I want to say that firstly. So many people come in with that kind of complaint. And really the best way to go about it is do a few basic tests to see whether this is normal, abnormal, unusual, and most importantly, whether it's something that has a cause and whether we can fix it. So just to go through some of the causes, all right, so any chronic illness can give you fatigue. So I'm talking about things like heart failure, kidney failure, liver failure. All those things will be associated with fatigue, as are other chronic infections, for example. So if you have HIV, AIDS, TB, that's going to give you chronic fatigue as part of the underlying disease process. Other things are nutritional. So for example, if you have an iron deficiency anemia, that's going to give you fatigue as well. Autoimmune diseases, as we've spoken about previously, will give you fatigue as part of the underlying disease. Okay. Now, for endocrinology, there are a number of hormonal disorders that can be associated with fatigue. So it doesn't mean that you have fatigue. You definitely have an endocrine disorder, but it is definitely a time to check. So the common endocrine conditions, diabetes mellitus, can present purely with fatigue. Even before people start having thirst, before they start having frequent urination, they can be tired. The endocrine disorders of thyroid disease, both an overactive thyroid and an underactive thyroid, can lead to fatigue. Other things are pituitary problems, adrenal problems. In fact, all have associated fatigue with other symptoms. And I think maybe we should talk about the other symptoms. So if people have a cluster of symptoms, that's going to alert them to go for attention.
All right, take us through some of those, including physically what we might be experiencing, Doc.
Right. So for diabetes, it's going to be the associated thirst, passing a lot of urine, waking up at night to pass urine, and losing weight. For thyroid diseases, it's going to be different for an overactive thyroid and an underactive thyroid. So for an overactive thyroid, people will have fatigue associated with weight loss, palpitations, heart beating fast, possibly getting short of breath. And sometimes they have growth of their thyroid, so enlargement of the thyroid gland. And if they have an underactive thyroid, it's the opposite. So weight gain, possible constipation, feeling cold, cold intolerance. Those are associations.
Doc, how do we know whether this is something, if we are talking specifically about fatigue and feeling fatigued at this time of year, how do you know if it's just simply a case of that your mind and your body are just tired, or that this is burnout? This is something more serious. You spoke about adrenals, and I'm guessing that burnout would have something specifically to do with that.
Absolutely. So when we talk about adrenal fatigue or adrenal insufficiency, it's a far more severe form of fatigue. People will tell you they can't wake up in the morning. They sleep. They're exhausted absolutely all of the time. And associations with adrenal disease is extreme and severe weight loss. They tend to have hypotension, so low blood pressures, low sugars, and it's that extreme feeling of just not being able to recover from it.
Okay, so is this kind of fatigue, this kind of burnout, is it something that's temporary, or is it necessarily the start of something that you're going to have to manage for the rest of your life, if I'm feeling that way now?
All right. So adrenal problems in particular have different causes. So it's going to depend on the underlying reason why you have the adrenal problem. For example, if it's autoimmune, that is a chronic disease, it's going to need treatment lifelong. It may be patients will have relapses and remittances. On the other hand, if it's a simple case of adrenal fatigue, that is precipitated by underlying stress. And often if we treat that, even over just a 6-month period, that can improve, and then patients don't need to be on treatment going forward.
How do you treat something like that?
So what I start with is a full history, full examination, because often it's not just one thing causing the fatigue. It might be a number of things. If it's adrenal fatigue, it is important to replace the hormones that are deficient. Often we start with a low dose, see how the patient tolerates it, monitor them with frequent levels, and that gets them feeling better.
So when we look at who is more, or who might be more susceptible, who might be more vulnerable to I mean, some of us, yes, are bouncing around. Some of us have the energy, even though we've kind of worked just as much as everyone else. You know, is there a particular grouping of people, whether we're talking about age, personality type, people in certain industries who might be more vulnerable or susceptible to this type of fatigue or burnout?
So there are studies that show that certain professions are more prone to this kind of fatigue. I know the medical profession in particular, other highly stressed professions, and you can argue at this time that everyone is highly stressed. I think what we need to make a distinction of is also whether people have recovery time. How do they spend their weekends? How do they spend their holidays? And I would honestly suggest and recommend to people that they do need to take frequent breaks. And the people that are more susceptible are those that do not have any recovery time, those that are shift workers and work continuously.
As an endocrinologist and somebody who specializes there, do you see ordinarily at this time of year a lot of people who may not necessarily have underlying conditions, like you spoke of diabetes, autoimmune, but who come to you saying, I just can't do this. I just have to stop right here for the year?
Often it happens frequently, and people realize that they have this overwhelming fatigue, and the reason for their consultation is there a cause? We test, and I would say in approximately half of cases, there are no underlying abnormalities. It's just end-of-year fatigue. But for the other half, there are problems, and it's a welcome relief when they realize that there's an underlying problem that can be treated that will help them feel better.
And it's so funny, isn't it, Doc, that sometimes we hope that our doctors actually find something so that we actually have an answer as to what is going on with us.
Often I have people saying, but I wish you would have found something I know I can feel better.
Yeah. So when it's just ordinary end of year fatigue, I mean, many people that I know are leaning towards not wanting to put a whole host of vitamins and medication into their bodies. They want to be able to pick themselves up in as natural a way as possible. But what's the advice? What are the things you're telling them, whether it's medication or whether they don't want to go the medication route? How do you deal with that? How do we balance that? How do we get ourselves up and running again?
So, in fact, my advice is predominantly lifestyle in nature. You've got to change some of the things that you're doing in the background. So, let's start first with eating healthy. I say to them, add fiber, add the fruit, add vegetables. So, particularly for those that are not keen on taking supplements, I would say you've got to eat a good organic vegetable diet that will give you all the B vitamins and the C vitamins that you need. Second thing, activity. All right. So sometimes people are tired because they do a lot of physical activity. But on the other hand, people are tired because they do no physical activity. So moderation is key there. I would suggest if they are completely inactive to add some activity. Third important one, so important, is sleep. So especially this year, people are stressed and anxious. People are not getting regular sleep. And it is extremely important for us to encourage at least 6 to 8 hours of good sleep that helps the body to recover.
Well, let's talk about COVID fatigue. Have you seen that? I mean, not necessarily people who have had COVID or, have any symptoms or anything like that, but just the worry about it, just the stress around it, just the change that we've all had to implement in our lives. Are people fatigued from that? Are you seeing that?
The time. I'm fatigued from that.
I'm sure.
So yes, that is a frequent one this year. It's that feeling of being so tired of hearing the same things, doing the same things, being anxious in the background about something.
Yeah. Doc, what are the dangers of not, for one, recognizing that you are fatigued or burnt out and then not doing anything about it, just hoping that this feeling it will pass? Maybe it's just today, or maybe I just need a couple of days just to, sit and binge watch TV or whatever. That's not going to solve it. So what are the dangers of not recognizing and doing something about it?
All right. So the dangers are going to be when there is an underlying condition. So if there's an undiagnosed endocrine problem, adrenal problem, and it's not treated, the patient's going to go on a path of worsening symptom. All right. So it's extremely important before that starts happening, that they go for a checkup and get treatment. On the other hand, those people that recover and start feeling better, in all likelihood, do not have an underlying hormonal or other problem.
Well, Doc, what is common, I suppose, at this time of year as well is many go, okay, well, as soon as I get my bit of leave, I'm going to sit down, I'm going to enjoy all the things that I want to I want to indulge. Some people may, alcohol might form part of their sort of stress relief or relaxation techniques. And I know you want us, or you spoke about nutrition earlier, but just a word of advice or caution in terms of, yes, you do want to enjoy. It is that time of year. We've all earned our right, especially in 2020, a pandemic year, to actually, treat ourselves a little bit where we can. But just the advice and caution from you when it comes to what might exacerbate or make this worse for us when we think it's actually going to help us relax, but it's not actually going to be doing that.
There's only one answer. It's moderation. So enjoy yourselves by all means. On average, not more than 5 units per week.
Not more than 5 units per week. Okay, so make it last, I suppose, is what you have to do with the little bit that you have. And I think just maybe some techniques or coping mechanisms for those who might not be able to get an appointment with someone like you. We know the waiting lists are long if they're feeling something, or they might not even be able to afford going to a specialist. Just what are the little things? Just a reminder of what we can start doing for ourselves. And of course, this doesn't end on the 1st of January. We've got to carry this on, I suppose, into the new year and make it a part of our lives, the coping mechanisms.
Absolutely. So I'm going to say, for everyone out there who's feeling tired, examine the diet, examine your physical activity, examine sleep, right? Those are the 3 big things. If there is any substance use or overuse, examine that as well. Make sure it's in moderation. Try and cut down as far as possible. If with all of those strategies there is no improvement, I'm going to urge them out there. Even go to the first doctor that you can go to the local clinic, go to your GP, get some basic tests done. And finally, by way of exclusion, it doesn't have to be just an underlying medical disorder. Many psychological, psychiatric, social disorders will lead to fatigue as well, and there is assistance for those too.
And definitely, Doc, that's exactly what our next guest is going to be talking to us about, the psychology of all of this and our mental and emotional states. Endocrinologist Dr. Daksha Jivan, thank you so much for that. Some of the simple things that we know we should be doing in our lives to help us cope, but we're not. If you are feeling that end of year fatigue, if you fear that you might have burnt out, especially in 2020, a pandemic year, well, we're trying to help you recognize that and take the smallest steps to help yourself for now. We'll continue our discussion with our psychologist when we come back.